Hello, friends. This is your part one of your podcast on Chapter P. I told you I wanted to go through some problems, really give you a way to think about to approach the problems we're going to do this year. Chapter P again gives you an overview of the entire course. So, what I'm looking for out of Chapter P is just a structure on which you can hang all the different ideas that we're going to cover this year. So, I've decided I'm going to start with this case study, which begins on page 3 in the book. If you open to that, you can follow along. It continues on page 26 after you've gone through the chapter, and then it refers to the homework problems 25 and 26. So we're going to hit a bunch of things here. So the first thing you do is read the problem carefully. And what you look at is that they have decided that these magnets can work with human tissue to do different things. And these scientists, so the scientists are going to be the who. All right. So as we're going through, we're trying to answer those questions. All right. And again, this is, the beginning of statistics for you. So if you were in the real world, you'd be more specific than scientists. But for right now, you're just asking the question who? Who is gathering the data? The scientists are. And what are they trying to see? They're trying to see, can the magnets reduce pain? All right. So as you're going, you can jot down on paper or just make mental notes um about the information that you're given. All right, so now we know what's going on. We have scientists who want to see if the magnets can reduce pain. They choose 50 patients, all right, and that's going to be our sample. And all these patients have polio. So the population of interest, all right, the group that we're trying to learn about are polio, and I'm going to call them victims for lack of a better word. All right, so that's the population. And the sample is the 50 people. Okay, so we got 50, and so what we're thinking is if we try this treatment on 50, that it'll probably affect the others in the population the same way that it will affect these 50. Now, again, polio is a problem from our past, but it still exists in other parts of the world. All right, so what do? They have these patients come in, they're going to give them a 45-minute treatment. All right, so we got a treatment now, and you should know what that is. That's going to be a 45-minute thing. Now, the important thing here is that how they do the treatment, the doctor will take an envelope that has a magnet that is either active or inactive. And they would expect the active magnet to have an effect and the inactive magnet not to. All right. And neither the patient nor the doctor knows uh, what treatment they're getting. All right. And that we're going to learn later is called double blind. And the reason we do that is that we want there to be no bias. In other words, if the patient or the doctor thought that they were getting a certain treatment, an active treatment, they would expect there to be an improvement. And they have a thing called a placebo effect, which we'll also learn about, where people feel better just because they think they got a treatment, even if it was a sugar pill or a fake treatment. All right, so that's what we're trying to guard against, and we do that by being double blind. All right, so my sample size, and we're going to come to call that the letter N, that's the number of people. Of the 50, we got 29 who got active magnets, and we got 21 who got the inactive. And what you see listed on page 3 is the final results of their pain rating. So all the patients in the 50 had pain ratings between 8 and 10. And after the treatment, they reported their pain. Okay, so the data we actually got are the final pain ratings of the individual patients. All right, and then what I want you to do is turn to page 26 and then look after you've read the book. All right, so assumes that you've read the chapter and watched the other podcasts, which give you a rough overview. You should be able to answer most of those questions on page 26, and that's what I'm going to do in part 2 of the podcast.